No parent wants to see their child in hospital, but if they must, they expect the best care possible. We now know that isn't always the case. Back in July, the new Labour government commissioned a review into the state of the NHS. Undertaken by former Health Minister Lord Darzi, the report is due to be published this week and has some alarming findings on child health. Last year, 100,000 infants, that's children under 2, waited for more than 6 hours in A&E in England. The report identifies a 60% increase in waiting times for infants in the last 15 years. It found that 800,000 children are currently on waiting lists for hospital treatment.
They're all facts and figures that are sadly really well known to me. But is it useful putting them together and putting them out as one and saying, look what's actually happening? And for the government to do that, yeah, it's really good to do that. And am I worried? I mean, I was worried before I saw this particular press release because I've been looking at these figures for some years.
In a statement, the Prime Minister said the impacts of a broken NHS are being felt across the whole of our society, our children included. The challenges we've inherited are stark, but I'm determined to fix the foundations so that we not only rebuild our health service, but crucially also reform and renew it for the benefit of future generations. Labour have taken every opportunity to blame the previous government, but they're now the ones in there at the Department for Health. Lord Darzi's review will help them diagnose the problems, but that's the easy part. Now they have to write the prescription. So what might some of these solutions look like, at least as far as children are concerned?
First of all, they should reduce the pressure on urgent and emergency care. We know that approximately a third to a half of children coming to the emergency department don't have an emergency. It's just that they've got nowhere else to go. So get that done, number one. Number two, reinvest in community health services. And the third thing is to improve how primary care, the local family doctor, and hospitals work.
Truly fixing the foundations will require time and money when there's little to go around. The new government may find identifying problems considerably easier than solving them. Matthew Thompson, Sky News.